Assalamu alaikum. My name is Itfa Ahmad and my roll number is BP1650096. My group number is 18 and my topic is ischemic heart disease, angina. As you can see, the topic indicates angina. So we will first discuss what is angina. Angina is pain, discomfort, or pressure in the chest. The most common types are chronic unstable. The most common types are chronic stable angina and unstable angina. First of all, we will discuss what angina is. It is the type of chest pain that occurs because of the reduced amount of blood flow to the heart. Reduced blood flow means that your heart muscles are not getting enough oxygen to supply to the tissues and organs of the body. Those who are suffering with angina get pain after some physical activity or emotional stress. It occurs by the discomfort and pressure in the chest. The most common types are chronic and stable angina. Now here we will discuss these two types. First one is chronic stable angina. In this particular type of angina, chest pain occurs when your heart is working hard enough to need more oxygen, such as during exercise or intense physical activity. The pain can go away when you rest. The pattern of pain, how long it lasts, and how often it occurs, what triggers it, and how it responds to rest or treatment remains stable for at least 2 months. This means that if the patient is having all these symptoms, then this type of angina is remain stable for at least 2 months. That's why it's called stable angina. After 2 months, it begins to show some serious problems or symptoms. Now we will move to our next type, that is unstable angina. This type is either newly caused pain or it is a change in the normal pattern of chest pain, whether it is worsening, lasting longer, or not being relieved by rest or medication. Unstable angina is a dangerous type and a warning of heart attack which require immediate treatment. Otherwise, it will lead to complication and can be difficult to manage. Now we will move further towards the other two very rare types of angina. The first one is variant angina. It is a very rare type of angina caused by the spasm in the coronary arteries. The second one is microvascular angina. It can be a symptom of disease in the small coronary artery blood vessels. Now here, there are some treatment procedures that I would like to discuss. First one is medication. Our first goal is to treat patient by simple medicines. If the person is not getting better or his condition is not improving, then we will further move towards our next two procedures, which are angioplasty and stent placement and enhanced external counterpulsation, EECP therapy. The last one is lifestyle changes. It is the most important treatment in everyone's life. By living a healthy life, we can prevent ourselves to from many diseases. That's why this one is a very important uh, treatment procedure. Now, moving further, I would like to discuss some other disorders which are related to angina. First one is claudication. It is the pain or cramping in the lower leg due to insufficient blood to the muscles, which results in the pain. This pain usually causes the person to limp. Claudication usually feels when the person is walking and if it is subsides while rest. If the claudication is severe, then the pain is also felt during rest. Causes of claudications can be due to the peripheral artery disease, which is caused due to atherosclerosis, which is accumulation of plaque made up of cholesterol, which leads to the blockage of arteries, which can eventually prevent the blood flow. As a result, the pain and cramps occurs in the legs. Now, the second disorder that angina patients often faces is peripheral vascular disease. It is a blood circulation disorder that narrows the blood vessels which are present outside of your heart and brain, and as a result causes blockage. This occurs in arteries and or veins. In perivascular disease patients suffer from fatigue. These type of patients suffers from pain and fatigue, mostly in the legs and mostly during exercise. This pain improves with rest. It affects the vessels that supply blood oxygen to arms, kidneys, stomach, and intestine. Now here, I would like to share the two pictures. One indicates the condition in the claudication, and the next one indicates the peripheral vascular disease condition. In these two conditions, the person suffers from the severe blockage, which results in the pain or cramp. Further, moving on, I would like to discuss my case study. And my case study is RO is a 65-year-old male with a 40-pack-year smoking history and a 13-year history of insulin-dependent diabetes mellitus. His ability to walk is limited by peripheral vascular disease and claudication, as well as uh, by exertional angina. A beta blocker is to be initiated for treatment of chronic angina. Which beta blocker would preferable for the patient? Now we will move further to what is patient's chief complaint. His ability to walk is limited and claudication is his major complaints. Now our patient age is 65-year-old and he is a male. I have a history of smoking for 40 years and onset of problem is 13 years. Medical history is that he has been on beta blockers and elevating factors are insulin dependent type 2. Our objective in which we will discuss our diagnosis and differential diagnosis. So the diagnosis is the chronic, he is suffering from chronic angina, and our differential diagnosis is claudication, exertional angina, type 2 diabetes mellitus, and peripheral vascular disease. Now, our assessment is about this patient is, as he has been the patient of chronic angina, the first line of treatment is beta blockers. He is also a smoker and a diabetic patient, so the effectivity of beta blockers may be reduced. Beta 1 receptor blocker, which is cardioselective, blocks B1 and as a result decreased heart rate and heart load, while non-selective blockers causes bronchoconstriction and hyperglycemia too. So we cannot prescribe him non-selective beta blocker because he is a smoker and a diabetic patient. So our plan would comprises of pharmacological treatment and non-pharmacological treatment. So first we will discuss our pharmacological treatment, that what therapy is needed and what drug and dose would be suitable for him. The therapy he needed is cardioselective beta blockers, and the drugs and the dose which are suitable for him are nebivolol and acebutolol. So first we will discuss about nebivolol. It is an extensively metabolized drug and has active metabolites. The half-life is 10 to 12 hours. It is taken orally and once a day. Dosing started at 5 milligrams per day with dose escalation as high as 40 milligrams per day if necessary. The second one is at acebutolol. It is a partial agonist. They rarely used in hypertension. 400 to 1200 milligram per day can be given by orally twice in a day and do not exceed it 1200 milligram per day. So our next point is non-pharmacological treatment. Exercise is best and suitable to treat claudication. And if he quits smoking, then he can prevent himself from peripheral vascular disease. So cessation of smoking is very important for him. Uh, there are some tests which we will recommend. We would like to recommend to our patient, that is ankle brachial index test, and the second one is angiography. Would be recommended if patient is still having those problems despite the pharmacological treatment. Third one is ECG, and the fourth one is echocardiogram. So this is all about my case study and my topic of presentation. Thank you so much for listening me. Allah Hafiz.